of a trach tube, a cuffed trach tube. And the other part of the tubing will be here with an exhalation valve, because his exhalation valve on the mask is on the mask. It's right up here, or around this area right here. That's where it senses the exhalation. With the circuit, which I didn't bring one, it'll be right here at the end.
Okay.
And if he's getting breathing treatments, he might have a nebulizer here too, an MT valve,
Okay.
where you can directly put the nebulizer in. Let me see if I brought a bunch of trachs that you can play with, and suction catheters, because this is the most important part. This is the trach, and this is the connection from the ventilator circuit to the trach.
Okay.
And this is in his trachea, and it's it's surgically placed in there, and this is a balloon. Now I have to look for my syringe. I wonder if I put one in here so I can inflate and deflate. So
Is it a special kind of syringe, or can
yeah,
use
it's basically a syringe that is it has an adapter.
one? Oh, okay.
Yeah, so I brought a bunch of these so that you guys can practice. So basically what I want you to practice is just doing this. There's gonna be an Omniflex in between. The most important part of being trach is managing the airway. You'll notice him be coughing sometimes. Sometimes you'll just even notice the pressure of the ventilator, the PIP, starts increasing. Or if he starts like having any coughing spells, then most likely you'll need to suction him. Okay. So this is the Omniflex. This allows the circuit to be a little bit mobile, so it doesn't pull, doesn't put too much pressure.
So it sticks out. It sticks out.
This
in
is
front.
sitting right there in his trach, and this weight right here
It's all
alone
outside, yeah.
is about like a couple of ounces.
Okay.
So you want as much less pressure on this. So sometimes we'll put a towel underneath here,
Okay,
so there'll be
I've
less
seen that.
weight being pulled on the trach.
Okay.
Because remember, on the other end of this trach is his trachea, inside his trachea.
Yeah, yeah.
So, and this is going to be secured with I'm going to put some pieces together for you, a trach tie.
Okay. Around his neck, huh?
Yeah, this will actually be around his neck. And it goes this way. And basically you'll change this as needed. You could probably change it if he showers. He can still take a shower with the trach tube.
Okay.
But you'll have to cover the trach with a paper, like a cloth, a face cloth. So you can cover the trachea. So this would be like his neck, and this is the trach tie that secures it. Okay? And then you're gonna have another part here. It's called the split gauze, the dressing, which you'll also change on a daily basis. So this goes right underneath here. It's gonna look like this.
Okay.
It's like his tuxedo, this tie. Okay, so it's gonna look like that. So it's a dressing to catch secretions that are gonna be coming out from the stoma. Okay, make sure you're focusing on that, not me. This.
Yeah, I'm catching it.
Okay,
Don't
oh,
worry.
good. All right. So we've got the parts here. We've got the trach tie that holds the trach in place. We've got the trach gauze or split gauze. And then we have the Omniflex. This is the Omniflex.
Okay.
It's called the trach adapter, which adapts the suction catheter, the closed inline suction catheter. This is a closed inline suction catheter. So that also can be replaced. And this should be replaced at least once a week minimum, but you can replace it up to 3 to 4 days. If it gets worn, or if there's a break in the seal, you should replace it.
Okay.
He'll be getting 10 of these a month.
Okay.
So you could replace it twice a week.
Okay.
This is what you use to suction his trach.
Okay.
And when you suction with this closed inline suction catheter, you can wear gloves, but if it's in a pinch and you need to suction him right away, you just make sure that you use your hand sanitizer because it's a closed system. Okay, so just sanitize your hands and you can just hold it here.
Okay.
If you need to suction him right away.
Oh,
And the
I see.
way to suction him is, because you'll have to connect this to the suction machine. Everybody knows how to use the suction machine here, right?
Yeah, yeah.
So it connects to here. And then what you do is you put 2 fingers right here on the Omniflex and you align this like that.
Kind of straightens
And then
down.
push it together and then hold it with your thumb here.
Okay.
And then you're gonna like grab a couple inches and just push. And if you feel resistance, it's hitting the inner cannula. So you gotta like twist and then push. Continue to push, and then you'll see it come out on the other side. No, you won't see that.
But it goes in.
But it goes in like that. And then when you turn the suction on, he's gonna start coughing because this is gonna hit his carina. That's the most sensitive part of the airway. That's where the right lung and the left lung bifurcates.
Okay.
It's called the carina. And when this touches the carina, it's gonna stimulate a cough reflex. And as soon as he starts coughing, you turn the suction on. This is on, this is off.
Okay.
This is on, off.
Okay.
So turn it on and suction 5, 4, 3, 2, 1, just like that. Okay? And then give him a break, maybe about 10 to 20 second break in between suction, sometimes 30 seconds. Some patients like to be suctioned right away. That's after they've been trach for a while. Then you repeat the process again. I'll hold here, push, and then suction. That one then really smooth. Turn the suction machine on. 5, 4, 3, 2, 1. Okay, important to note, there's a black dot line right there. Everybody see that?
Yeah.
That is basically your symbol to make sure that this part is, you can see it in here. It's in the bottom part, right there.
Okay.
So that basically there's a tip right there. You see the tip? You don't want to leave this catheter like that. That's blocking the airway. So you want to make sure that the catheter is inside its garage. I call this the garage.
For the guard.
Yeah, inside the garage. Okay, and then when you're done, just let it go. And then to clear out the secretions, you don't want to leave the mucus in here. So you have to have a syringe, like a. We'll provide all the saline bullets. You'll stick the saline bullet in here,
Okay.
and then you'll basically turn the suction on and squeeze the saline bullet. Excuse me.
Also, it's
And then it'll be pulled. The saline will be suctioned right out, and it'll flush the catheter. Okay. So you can see all this online. If you go to YouTube, there's suctioning with closed inline suction catheter via trach, and then there's single-use catheters via trach. But this is your predominant way of suctioning Dan when he gets a trach, is the closed suction catheter. Okay, so all of you get a chance to practice with this. I'll make another one. Go ahead. So I'll make another one for you.
So you want to practice suctioning?
Yeah, just
Okay.
your hand is not going to be there. It's going to be like that on the side, like
Okay.
that. So his neck will be right here.
Okay.
And then what you do is you start here,
Start
and you
here.
thread. If there's a resistance, just, yeah, there you go. Keep going. Keep going. Keep going. All the way to the end. And then suction. And pull.
1,
pull.
2, 3, 4, 5.
Good.
Okay.
Are you nervous?
I have hand tremors.
Oh, okay. All right. That's good to know.
Yeah.
So when you suction, you have to start here.
Start here.
And then thread. Keep threading.
Right in my.
There you go.
I just pushed it through. It popped through. Is that okay?
Yeah.
Okay.
Suction.
1, 2, 3, 4, 5.
Good. Okay. Good job.
All right.
All right. Here, I'm gonna make another one. So I'm gonna practice. Yeah, I'm gonna go get the.
Looks good.
So basically, when you're putting your suction together, catheter as a replacement. You're gonna open this up,
Okay.
and you're gonna keep a sterile field, and you're gonna put this here, and then you're gonna use an Omniflex, where did they do with that Omniflex?
So that's
Oh, there it is, it's already attached. So basically, you'll have your Omniflex here, and your trach. This is a smaller one, so that goes directly right there, and there. That's what it looks like.
so this goes in the trachea. This is the Omniflex.
Yeah,
That's the
it's a
catheter.
closed inline suction catheter.
Okay.
All right, and this is a smaller trach. It's a 6. That's probably an 8.
Okay.
So again, you can practice doing this. Align it.
So
And
you
then-
straighten it out and line. Okay.
So like if you get if there's resistance, you have to twist
So
and then
that's
push
just-
all the way through, and suction on
Then pull.
and
suction
pull.
and pull.
5, 4.
So it's
Three,
just the
two,
twisting effort that helps get
That
it
helps to
through.
get it.
Yeah,
Okay.
yeah. Because what happens is, if you look here, when you thread, see that? It may hit here,
Oh, okay,
so you have to twist it and push
Got it.
to get it through,
got it. Okay.
like that. That's the inner cannula, and then you just push the rest of the way, and then he's gonna start coughing. You suction. 5, 4, 3, 2, 1. Okay. Sometimes you can stay in there a little bit longer if you're getting a lot, but you also may see him go take a breath in like like this when if he's taking a breath like that during you're pulling out of suctioning. Just release this so he can get the breath in,
Okay.
and then once he gets the breath in, then continue to suction and pull the rest of the way out.
Okay.
Okay. So here you go, and I'm gonna go. I need to go get my syringe so we can show you how this gets inflated and deflated.
Okay. Let me stop this.